Let's talk a quick minute about harm reduction. What is it? What is harm reduction? So it's a way of meeting people who use drugs, meeting them where they're at, and realizing that people use drugs for a variety of reasons, and that people who use drugs still are worthy of dignity and respect, and just meeting them where they're at and providing them with the support and resources and unconditional positive regard and education as well, supplies to make their drug use as safe as possible, because obviously, just outlawing drugs and trying to stigmatize people who use drugs, that doesn't make people change, that doesn't save people's lives, that doesn't make it any safer. It has all of the opposite effects of that. So some things like needle exchanges reduce harm, because people who inject drugs don't have to share needles, so there's less likely to be diseases and illnesses being spread because of people having to share needles. Giving people Narcan to use if they're with somebody who overdoses on a opioid, then they can be given Narcan, which reduces a opioid overdose. MOUD, so medication for opioid use disorder, things like methadone and Suboxone and Sublocade. I think Sublocade, yeah. All of those can help with with uh, with reducing overdose deaths for people who still use opioids, and then they're on one of those medications. So that's really great. Um, Giving people safe smoking supplies like bubbles, so they're not having to share. Again, that's a kind of a disease and illness prevention, as well as preventing cross contaminations of different substances that the person might be using but not having been exposed to before if they're sharing. Then education, right? And meeting people where they're at and realizing that harm reduction exists on a continuum, and it extends even beyond people who use drugs and drug use, right? Driving, it would be a lot safer if cars didn't exist in the world, but that's not really, based in reality. So we all drive and do things to try to make that as safe as possible, like wearing seatbelts, obeying the speed limit, stopping at crosswalks, turning our lights on at night, etc. And so the same thing exists for harm reduction, right? It's a set of principles and a kind of philosophy of meeting people where they're at and treating them as humans who just happen to use drugs, and realizing that they're worthy of dignity and respect no matter what type of substances they use or don't use. And then providing education, right? Making their use as safe as possible. So for example, if they're using opioids, fentanyl is super, super prevalent now in the US supply of opioids, mainly. I mean, even if you're, say, buying meth or cocaine, it's probably going to have some fentanyl mixed in there. So providing like fentanyl test strips could be somewhat helpful. Letting people know if you haven't been using for a while and you start again, your tolerance is going to be a lot lower. And in general, it's just good to use a little bit and wait, take longer with your use, and you could always use more later. That's safe. Try to use around others if you can. There's a number that you can call, like never use alone line, something like that. So there's always somebody around, particularly in person. If you overdose, having that Narcan available. Let's see. Yeah, so it's a little bit about harm reduction, something that I think is super, super amazing and really empowering and human-centered. And again, it's all about meeting people where they're at, because this country has tried the whole stigmatizing and demonizing and criminalizing route. That does no good for anybody. We need to meet people where they're at, and when they're ready, if they're ready, if they become ready to make changes, wanting to get on MOUD or inpatient or groups or intensive outpatient, whatever it may be, then you're there and you have that trust and rapport for when those people decide they want to, if they want to make that change. But people don't change till they're ready, right? And there's stages of change for a reason, and everybody looks different for everybody. And that's what I really like about harm reduction, is meeting that individual where they're at, providing them education, supplies, unconditional positive regard, as Rogers talked about, and just being able to have conversations, getting to figure out why this person is using, when did it start, what do they get out of it, right? Because people use drugs because it makes them feel good. It's a coping mechanism, right? People don't use drugs because they don't like the effects. They like the effects. There might be side effects after that aren't so pleasant necessarily, but it's a self-medicating, right, for a variety and a combination of reasons. So harm reduction, it's great. It's super, super great. And again, harm reduction saves lives. Peace. Much love.